All right, let's unlock every cure. We've got a big ambitious goal. We want to repurpose 15 to 25 treatments for 15 to 25 horrible diseases by 2030. I'm Dr. David Fajgenbaum. I'm co-founder and president of EveryCure and also a physician scientist at the University of Pennsylvania. EveryCure is a nonprofit that's on a mission to save lives with the drugs that we already have. There are about 4,000 FDA-approved drugs, but there are still 14,000 diseases that don't have any treatments. AI has been fundamental for us to even think about the problem space of all drugs and all diseases. Thanks to Gemini, we're able to look across the world's knowledge of all drugs, all diseases, to put it all into one place so our data scientists can find promising repurposing opportunities. I was a healthy third-year medical student, and out of nowhere, I became critically ill. I was eventually diagnosed with a horrible disease called Castleman disease and given 7 different chemotherapies to try to save my life, but I would have a number of relapses. I found a drug called sirolimus, and the moment that that drug started to save my life, I have not been able to stop thinking about how many more drugs are already available sitting at our local CVS that could save more lives today. If not for AI, we wouldn't be able to even think about doing what we're doing. We need Google Cloud to power all of the analyses that we're doing. Given that we're doing something that's never been done before, it's essential that we do this all in one platform, and to be able to utilize tools like BigQuery and cloud storage to really productize and scale these early machine learning models. We needed the Google backbone for taking what was an early idea for a small model and applying it at scale. There's 4,000 approved drugs and 18,000 diseases. So if you tried every drug for every disease, you'd try 75 million attempts. We're pioneering what we call computational pharmacophenomics. And the idea is that we don't start with a single drug or a single disease and look for matches. We utilize the power of Gemini to quantify the strength of evidence between every single drug and every single disease, and then let the data tell us what is the strongest match across everything. So it's the best opportunity to help people. When we first built our platform, it took 100 days to run the model. GPUs have just been essential in our work to get from what was a 100-day turnaround time for our predictions down to about 17 hours. Gemini helps us to supercharge these predictions so our humans can spend more time on the best opportunities. Just running this platform for 1 year, we already have 9 active drug repurposing programs. One of the reasons that there are so many diseases without treatments is because there are no incentives to find new uses for old medicine. So those 4,000 drugs, over 80% of them are already generic. No one makes any profit whatsoever off of finding that new use. EveryCure is a nonprofit organization, so we don't need to pursue profitable conditions. One of my favorite ones is lidocaine in breast cancer. Really interesting data that injecting lidocaine around a tumor before surgery can reduce the risk of metastasis at 5 years by as much as 29%. With a bold mission like we have, we need amazing partners, and we would not be close to where we are without Google. With Google Cloud, EveryCure is building a new way to save lives with the drugs that we already have.